We're going to get caught up on the latest news about the coronavirus and our battle against it. Dr. Kevin Kavanagh of Health Watch USA joins us as always. Doc, good morning.
Good morning.
Glad to have you back. As always, there's a lot of stuff to talk about. Let's start with the rollout of the Pfizer vaccine this past week. Did you see any issues with that? Did everything go so far the way you thought it would?
Well, right now it's going as I expected. There are a few patients, very few, that developed an allergic reaction, but you need to remember that the numbers, well, you can count those on your hand. Think about 3 or 4, and that's out of really millions of doses. And similar to going to a restaurant to eat food, you may get an allergy and have to have an EpiPen given, but those are few and far between. The good news is they found extra doses in the Pfizer vials so that they'll have more vaccine than what they originally planned for.
How's that work?
Well, I think they added a little bit in case there was some spillage, or maybe they used a larger needle with a larger lumen, and that they would be sure that I have 5 doses. Well, what happened is they sometimes now have 6 or 7 doses. So that's a good thing. And that comes on the heels of the Moderna vaccine. That was just approved last night. The vote was 20-0 with 1 abstention. The Moderna vaccine uses very similar technology. So these, I think, are quite exciting. They are very safe vaccines. They're on a new technology, but one which elicits only a very specific immunological response, and it bypasses a lot of the cellular mechanisms which maybe could give a reaction. So what these vaccines do is directly deliver mRNA into the cell. Now, this is not DNA. It has nothing to do with genetics or DNA. It delivers mRNA into the cell to make the spike protein, and a very specific immunological response to that spike protein is made by the body. And that should hopefully cut out a lot of the theoretical mechanisms and problems that might occur. I think this is a safe way to go.
All right. Senator McConnell says that he's going to get one just as soon as they let him, basically.
Yes, and that is a very wise decision. He made a statement that the only way to beat this pandemic is for us to follow the advice of our nation's healthcare professionals. Get vaccinated and continue to follow CDC guidelines. And this also comes after Chris Christie has released a tape or video in an ad encouraging people to wear masks. As you know, he visited the White House without a mask, got the coronavirus infection, and was in the ICU for 7 days. He became severely sick, and that's with receiving top-notch medical care. Bill Frist, who's the Republican senator from Tennessee, has also advocated that his governor in Tennessee implement a mask mandate and encourage other governors also to do the same. Tennessee is literally eaten up with this virus right now, and unfortunately, they've even started to implement mobile morgues. The case rates and deaths are just skyrocketing. So following public health advice is key. If we do this, maybe we'll get like Australia, where adjusted for population, we would have only 13,000 deaths in our nation at this point.
You mentioned mobile morgues in Tennessee, and another headline this week came out of California when California state government ordered 5,000 body bags and some refrigerator trucks.
Yes, and the refrigerator trucks are the mobile morgues, obviously, and they're also running out of healthcare personnel. You need to realize, Scott, that when the beds fill and the hospitals fill and the healthcare personnel run out, fatality rates do go up, not only for COVID-19, but also for other illnesses. Look at the recent report in the Courier Journal regarding the increase in deaths from overdoses, skyrocketing from around 150 or less to what they think will be 600 this year. So this is going to impact a lot of other diseases if our healthcare system gets overrun. Luckily, in Kentucky, we're not in that situation yet because a lot of people are following public health advice and we need to get everybody else to do so.
As we talk about the facilities that are available, and we hear about hospitals saying, well, we're going to have to convert some rooms for treatment of COVID patients, physically, what's going to be involved there? What's it take to take a hospital room and take it from, everyday use into something that's going to treat this special disease?
Well, it's very problematic because one, you're not going to have proper airflow, and two, you're not going to have the trained staff. It's not so much the physical space on where to put patients. You can, of course, get a monitor. I mean, an Apple Watch can monitor a patient almost, not nearly as well as an ICU, but it's not the equipment that's so much the problem as right now the staff. They are getting tired, they're getting burned out, and there's more patients than there are staff. And this is one of the reasons why the staff, hospital staff, is moved to the head of the line as far as getting the vaccine. Because if we can keep them from getting sick, this will help relieve the staff shortages.
Bill has texted us from Lexington saying he has heard that only 40% of nurses and 60% of doctors plan to take the vaccine. Wants to know if you know why.
Well, I don't know why, and I think that is problematic if that happens, because they're in a position where it is not if, but when they will develop the infection. So the vaccine, when you look at the science, is much safer than getting the virus. You're not getting a live virus. You're not getting all sorts of different antigens that may make God knows what type of immunological response. As you know, there's been autoimmune reactions, systemic inflammatory disease from this virus. The only thing these mRNA vaccines are given is the spike protein to generate the antibodies to kill the virus. So going the route of the vaccine looks much more safer than going the route of trying to get the viral infection. And as we've heard from multiple guests and speakers on different shows, some patients are starting to get reinfected. The immunity may not hold from the virus. The vaccine, because it's given twice and because it just elicits the response to that one area of the virus, this is going to give you theoretically better immunity than getting the infection.
When this broke out in the spring, I was due for checkup with my doctor, and I called the office and I said, what do we want to do? And they said, let's hold. Let's keep things open for the biggest cases, just a regular checkup like you've got coming. Let's hold. So instead of going in March or April, I went in July. Now I'm due for another checkup. I haven't made that appointment yet, simply because I've been busy and lazy. Is there any reason for me to put that off? Just a regular checkup with my doc?
Well, at this point, the answer is no. I can't give you a time period when we may come out of this pandemic. This virus is already in animals. We're probably going to have some low level of infection right now for many, many years, if not forever. We may need to live with this virus, but not at this level. Granted, we're going to return to a more normal situation. But if you go anywhere, the healthcare setting is the safest. Now, during this pandemic, I've had my blood drawn twice. I've gone to the dentist once. I've had my physical. I've had a colonoscopy. I've had another major biopsy. I've gone to the dermatology twice. And I've had 2 cancers diagnosed, none of which are major. But nevertheless, if I would have put that off a year, I would be in trouble. And I can tell you that I felt much safer going into the doctor's office where protocols are being followed, people are social distancing, people are wearing masks, you have good air filtration and sanitization, rather than going into any other venue. So if you're going to do anything, get your health care taken care of, because you don't want to become collateral damage to this virus, and that's the real risk.
Got a text from Josh here, Dr. Kavanagh, getting back to the questions about the vaccine. Josh says, my wife is a nurse, and she and her nurse friends are hesitant to get the vaccine because they feel it was rushed to market with less testing than would normally happen. Has the need for speed here given us anything that we should be wary of in terms of the vaccine?
Well, Overall, the answer to that is no, because it really wasn't rushed to market. They started developing these vaccines many years ago, and this is actually old technology from that aspect. And that allowed them to bring it to the market quite rapidly and to test these vaccines when really we've had very, very little time compared to other vaccines. And you have now over 2 months worth of data that is already stored and been analyzed. And so this is very good because the vast majority of adverse reactions will happen within the first 2 months of vaccination. So I would go on ahead and, I would get it. I really would.
You just wonder because we keep hearing, and perhaps this is the media trying to find a story, but we keep hearing, wow, this is great. We got this inside of 9 months when it usually takes 10 years to get a new vaccine to market.
Well, it's a different technology. It's one that involves really a computer, the genetic code of the virus, and it generates a vaccine. And this has been researched for years now in preparation for the coronavirus. This has been the number one virus that people have predicted that would create a pandemic. So this has been a great advance. And I certainly, if you're in a frontline working position, would get the vaccine. If you're not going to be able to get it right away anyways, and more data on safety will come out. But there have been large randomized controlled trials of approximately 30,000 people that have looked at both the safety and efficacy of these vaccines. Now, I should add that it is important that if you get a vaccine, that you get follow-up, and there is a CDC program called vSafe. And vSafe is a program that uses your text phone, whereby you register online, and it will contact you with text to ask you how you are doing. It does it once a day for a week, and then once a week for 6 weeks, and then at 3, 6, and 12-month intervals. And it will ask you if you missed work, if you're unable to do normal activities, and if you received medical care. And if you answer yes to any of those 3 questions, the CDC will contact you. So go to cdc.gov/vSafe, and that's V as in victory, vSafe, and get registered once you get a vaccine.
All right. We hear every year when it's flu season that, well, the flu vaccine will cover you pretty well, but it doesn't do it exactly because the flu virus is always mutating, and it's a little different this year than it was last year. We hear once in a while, and we've heard this week of one discovered in the UK, that the coronavirus has thrown out a few mutations. Is there anything to worry about there?
Well, we're going to need to watch that very closely. This vaccine is different than the flu vaccine in that the flu vaccine is a guess on what the virus is that's going to hit America.
Right.
This vaccine uses mRNA on the virus that's currently infecting us. But new vaccines are going to probably have to be developed if the virus mutates. And that's one of the reasons why the idea of herd immunity and let's just spread around the virus is absolutely insane, because it is going to cause this virus to mutate. And if that happens, we will have to take another vaccine and develop another vaccine. Luckily, with technology that we have with this mRNA vaccine, they can print that out and develop it within weeks as opposed to years. So our technology has advanced, but it is imperative that we slow down viral spread so nature doesn't outpace our ability to make these vaccines.
What do we know at this point about the coverage that these vaccines provide for us? I mean, do we need to go back and do a booster every so often like we do every 10 years with our tetanus shot? Will this cover us for good? Are we always going to be looking over our shoulder for the next wave of COVID coming to town?
Well, unfortunately, I think it's going to be more the latter. I don't believe many people feel that this is going to be a one-time vaccine for life. We just don't know how long it will last. And that is one of the downsides of having it come to the market so soon. You get a good idea on short-term efficacy, but you do not have the data on how long it will last. That is why it's important to monitor patients, and why it is also important that if you get the vaccine, you still wear a mask, you still social distance, and you follow public health advice.
All right. At the beginning, all of the advice we got was if you have been exposed, if you have symptoms, self-isolate, quarantine for 14 days. A few weeks ago, the CDC dropped that back to 10 days, and now we have a story from the University of Kentucky saying asymptomatic students may be nearly as safe 7 days as they were at 14.
That's correct, and I think it's 7 days plus a test. Okay. And that was actually one of the CDC options of 7 days, you get a test at 5, 6 days, and if that's negative, at the end of 7 days, you can get out of quarantine. It's not as good as the gold standard of 14 days, but it may be able to be followed a bit better by the community. Compliance is a problem, and certainly students that are at UK, that are less of a risk, healthier, have a better immune system, it may be a much better fit, and that's what the University of Kentucky is studying.
All right. Got a texter that wants you to put your money where your mouth is, so to speak, says, is the doctor taking the vaccine?
The doctor would love to take the vaccine, but not being a frontline worker, I am down the list. But if you all would write in and complain to the governor that you think Dr. Kavanagh ought to set an example and take the vaccine, that would be okay with me. But I am second tier. I'm not a frontline healthcare worker, and I am not in a nursing home, and there is a vaccine shortage. So I'm probably looking at February, March before I'll be eligible. And I mean, I hate to say this, but everybody who doesn't want to take a vaccine is going to move me up in place.
More for me, huh?
Yeah, well,
so to speak.
I mean, yes, that's the truth. This is something I think is good to take, and this is the Moderna and Pfizer vaccine.
Here's a professor at the Tufts University School of Medicine. I think Tufts is that in Boston? I'm not sure. But this professor has come up with one of those, well, yeah, why didn't the rest of us think of that ideas? One of the most common symptoms associated with COVID is that people say, first thing I noticed was my sense of smell and my sense of taste was gone. And this professor is suggesting that the fast way to know every morning whether you have to be concerned or not is when you make your coffee, stick your nose in that can of grounds, because that's a good, strong smell that everybody is very familiar with.
Well, that's going to be certainly a warning sign if you have lost your sense of smell. But I wouldn't rely on that solely. If you have other symptoms of COVID, shortness of breath, fever, cough, you need to be very concerned and should seek medical care and get tested. And of course, call first ahead of schedule. Don't just show up at a office saying, hey, I've got COVID. You need to call your doctor first and ask what to do. So if you do lose your sense of smell, that is a huge danger sign, very specific for COVID in this day and age. But many people will develop other symptoms initially.
All right, Dr. Kevin Kavanagh, I got 5 seconds, so I will say thanks, goodbye, and we'll talk to you on Monday here on 97.3 FM WVLK.